I am so glad to introduce you to the next speaker, Dr. Sergey Minaev. That is such a wonderful doctor. He's an orthopedic dentist that was studying all over Europe, that is having a very special view of seeing the stuff thanks to all the different fields that he was studying, that he was taking stuff from, to put all of them together to propose another view of his job. He's doing what we could call the neuromuscular dentistry. He's also focusing a lot his daily practice on the posturology applications and the tmJ applications, on all the stuff that are linked to the occlusions, which some dentists are, of course, doing all over the world, but that Dr. Sergey Minaev was especially focusing on. And that's why today he's going to speak to us about the aspects of using myofunctional appliances among patients with signs and symptoms of temporomandibular disorders. Sergey, I let you speak.
Good afternoon, dear colleagues. I'm very happy to welcome you on this spring day. My name is Sergey Minaev. I'm from Moscow, where I live and practice, and today we're going to speak about the aspects of use of myofunctional appliances for the patients with signs and symptoms of tmJ disorders. And a couple of words to introduce myself. In 2002, I graduated from the State Medical University, and I continued as a postgraduate student, where I worked as part of Moscow Committee of Experts to assess the quality of healthcare. In this period, from 2002 till 2008, we had a lot of complaints, especially complaints for tmJ. And this actually drove me to postgraduate education, and I continued with postgraduate courses around Europe. And I'm very happy to be working in cooperation with doctors from Paris and from Berlin. And I participated in the Congress of Academy of Applied Science in 2020. And I participated in this congress, and I did some work together with some doctors. And one of the doctors is Theodore Belfer, and who presented together with James Lester. And this journalist then published a book which became a bestseller, which is called Breath, and which was translated into several languages, in Russian included. And you can buy this book and read in details. And he showed the use of removable appliances and nose breathing. And he worked with computer tomography, and where he showed the change of airway development despite of the age of the patient. And I decided to share my clinical experience
with myofunctional devices, appliances. while treating patients with temporomandibular dysfunction. Here we see how his upper arch looked in 2017 when the patient came for the first time, and how maxilla looks like now. Below you see the results of CBCT imaging. It was the same device was used to take this X-rays, and we see that the bone has remodeled, especially in the frontal area. The next slide shows us how the maxillary sinuses are. In the area of second molar, we say that the aeration of the sinus, the size of the sinus has increased, the volume of air has increased around the tooth 2-7. On the left side, second molar on the left side, the same situation. This has a huge importance in the world of COVID infection. This pandemic has taken a lot of lives, and internet provides us with a huge amount of information considering the importance of nasal breathing in prevention of COVID-19. As prosthodontists, to work with our patients in the most functional way possible, we try to use different articulators. And this is an article which was published in 2002 showing by Professor Bernard Cordes, who tried to develop virtual articulators, and he underlines that the future of dentistry is strongly connected with virtual technology. At that time, it seemed not real, but now virtual technology has begun to be our everyday practice. Virtual probably sounds in wrong way. Virtual feels like something artificial, something which is not real. This is why I propose the term digital, not virtual. A lot of our colleagues ask me if digital impressions are as correct, as precise as traditional ones. In our era, when we are using so many smartphones, we take pictures with them, we exchange information with our friends and colleagues, we use so many social media that the question about accuracy of digital impressions seems to me a little bit strange, and I'm surprised that our colleagues are afraid to pass to digital technology in their professional field. A very interesting stage of professional development could be the phase of using the 3D printing, because this technology will give you a sense of reality, that all those things you develop on the computer, on the screen, you can print them out, and it brings you up. It gives you a lot of energy and confidence in your work. Digital technology is a subject of a separate lecture, and today I would prefer to speak about how digital technology helps us to find the correlation between temporomandibular dysfunction and the whole body. This correlation, as for me, is the reason to use myofunctional appliances to normalize the function and thus increase the health of the whole body. Today, this question is still being discussed in different fields because it is rather difficult to assess the posture and the movements of the mandible. For that, we need to use a lot of special appliances and devices, but thankfully we work together with the Zebras company located in South Germany. This company provides us with a huge wide spectrum of different devices for different professionals. I would like to show a clinical example of this connection between temporomandibular dysfunction and such functions as walking, for example. The patient is 37 years old. She says that she has some pain in the area of the joint. We started our job with masticatory analysis. On the upper image, you see the real-time picture of her jaw movements during the mastication. You can visualize this process in different angles, rotating models as you wish. In the lower part of the picture, you see the walking assessment, how the force is distributed during walking. Speaking about the walking analysis, we have to analyze this process from three different points: from the top, from the side, and from the front. We can also ask for a very specific information, the frequency interval, which shows us how often certain cusps and fissures touch each other. Where are the most frequent contacts? We see that left molars are much more frequent to bite on each other. So mostly mastication happens on the left side. If we look at the mastication function from the top, we see that the left tmJ is working, its movement is to the is outward and backward. This type of movement is not desirable for the joint and could lead to pathology in the joint. On the right side, you see the stabilometric report or stance report, which gives us information that the projection of her center mass is moved to the left and backwards as well. The position of her soles on the surface gives us information that her left foot, while standing, is positioned more distally. The walk-in report has a lot of information. I've chosen only the graphical representation. because it is the easiest for understanding. It's called a butterfly diagram. And as we can guess easily, there are different types of butterflies in the world, but I don't think that there are some of them having asymmetric wings. They are mostly symmetrical, having left side the same size as the right size. But it happens that during walking and in real life of our patients, we notice that the center of the body mass is mostly moved to the left side and is not located at the center of the diagram. We also see that the footprint of the left foot is shorter, so the pathway with which it touches the ground is shorter when compared to the right foot. I would also like to come back to the Congress which happened in 2020. I made a lecture about pathological occlusion, Class 2. Our patients were divided into two groups depending on their age: under 13 and over 13 years old. The adult group also mostly had tmD, temporomandibular dysfunction. And then we tried to assess the head movement by means of ultrasound. The result shows us that in both groups there are similar patterns of head movements during swallowing, and especially not only in retrograde direction, but also the mandible rotates to the right or to the left. Our position on that is that this exact type of swallowing might be the reason for the dysfunction. And due to the wrong position of a tongue leads to this one-sided chewing pattern, which leads consequently to the dysfunction. As for me, it tells us that myofunctional therapy is the exact way to prevent temporomandibular dysfunction. The froggy mouth concept proposes to intervene rather early, starting from 3 years old, and literature supports us here, saying that after myofunctional therapy, you will not have the future symptoms. American Dental Association has also some recommendations saying that even the slightest clinical symptoms in early age are to be treated myofunctionally, because otherwise it will lead to postural problems with head or neck and other severe complications. This is why we are sure that temporomandibular dysfunction is to be undoubtedly treated together with myofunctional treatment, and just like virtual articulators seemed to be not real some years ago, I'm pretty sure that very soon we will have the opportunity to use these devices in Russia. Thank you very much for your attention. I hope that you liked my presentation today. When we assess patients with temporomandibular dysfunction, we decided to find out what are the connections between different age groups and different classes of occlusion.
From the study that you made in 2020, what can you tell us about it?
During the clinical of this research, when we compared the when we compared the results between different occlusions and different ages, we found out that temporomandibular dysfunction is somehow connected with a symmetrical position of the mouth in oral cavity, which is a direct indication to use myofunctional appliances, especially in class 2 occlusion. Of course, when you have an opportunity, when we have an opportunity to use this appliance, Froggy Mouth, in our practice, we would love to repeat this research. We would love to have the control group and the test group, and we are very interested in the results and would like to see what's going to happen.
For the rest of the sequence, we are looking forward to the rest of the sequence, so please ask us.